Hello everyone, welcome to OET Answers. In this video, we are going to discuss about comprehensive type questions, especially which comes in the reading subtest. So in the part C, majority, you can see 2 to 4 questions like a what point is made like, okay? We can see about it detail throughout this video, right? First, you can see 3 different questions, right? Yes. What point is made about the symptoms in adult women? Second one, what point does a writer make about IVF treatment? Third one is, which point can be made from the second paragraph? Okay, so these 3 are the same questions but different structure. But while seeing this question, we can understand what point is made. What point does writer make? Okay, make, made, what point, and which point can be made. Okay, so there must be 2 words: point, what point, which point, and what can be made, what does the writer can make. So these are the 2 words repeatedly will be in the questions. Okay, so by seeing these points, you can understand this is the one of the detailed type questions. Okay, so what point does the writer make, and what point you can learn from this paragraph, what point is made from the paragraph, everything you can see while reading the questions, as well as you can understand that. And whenever this type of question comes, what you have to do, you have to understand where should I read. Okay, so if they given a particular paragraph, in the paragraph you have to read the entire information, but I'm damn sure the exact answer they have given in the end of the paragraph. Okay, at the end of the 1 or 2 sentences, you can see end of the paragraph. So that's why the question has been made, because what point is made? What is the meaning of made? Made means already done, right? Already have done something. So whatever, if you see a study and study results, at last, so initially they will explain about the study, at last they will give the results, right? Same like these questions. Initially they will give some descriptions of the particular topic, but at last they will give what point is made. Made means at last they will give the conclusion of the particular point, right? We can see this in about detail. Okay, what point is made? What is what point is made? In the context reading comprehension, the term point, okay, already I told you, you can see the point word that refers to main idea or key argument. Okay, so if they are talking about something in the first paragraph, their main idea, okay, that's main idea, or that's the main information they will provide at last of the paragraph, right? That is being expressed in a specific part of the text. So when you asked what point is made, this is your question, you are essentially being asked to identify the main idea. Okay, immediately you have to understand the main idea, the key argument, and the author is making the section of the text. So the information will be present in the section of the particular paragraph, right? This is the what point indicates. How to approach this type of questions? How can you approach? I will give you small tips. You can see, right? So in this area, I didn't show the clear picture of the endometriosis. So a little bit blurred, right? Yes, I want to explain about the approaches first. Later we can go for that. First, how can you approach this type of questions? First, you have to understand the structure of the question. Like what point does writer make? Initially in the first page we saw 3 questions, right? Same like it will be there. Second one, read the question and understand the meaning. Immediately what you have to do, you have to understand the question first. What point is made? What point is made means something we have to look in this area, and made means something they have stated already. Okay, and understand the meaning of question. Third one is respective paragraph. Okay, read the respective, if they given in the first paragraph, read the first paragraph and move on to the fourth approach. Focus more on the bottom of the content. Okay, if you want to find out the answer, your focus would be finding the answer in right location. So as I said, bottom of the paragraph. Coming to the 5th point, sometimes contrast words will be supportive, like although, however, even though, because, but. So these are the contrast words will help to enhance the sentence little bit. It will highlight the point. Okay, sometimes it will help. Sometimes the words you cannot find in the location. Okay, so just be aware of it. Coming to sixth approach, read and confirm. Okay, so once you done all the 5 steps, what you have to do, you have to read again and confirm whether I'm choosing the answer from the right location as well as I'm choosing the answer for this question. Okay, then coming to seventh point, elimination method. Okay, this is a very important method. Keyword method and elimination method are two vital points in the reading. Okay, so definitely when you're choosing answers, it would be really difficult, as well as you will be wasting your time. But if you eliminate the wrong options first, very shortly you can take the right answers. Okay, so I always prefer to do elimination first and choose the answer at last. Now we can see the exact example of this type of questions. Okay, so your title is endometriosis. Your question is word point. So as I said, you can see word point and made. These two words you can see in the question. Word point, what is point, is made about the symptoms in adult women. The symptoms in adult women. Okay, so you got the paragraph now. There you have to first search for where the symptoms in adult women they have given. Okay, in the location, what point made. Okay, that you have to find out and do elimination first. Finally, choose the answer at last. Let's start. Endometriosis causes 3 major clinical disruptions. They are pain, infertility, and malignant transformation. The most common symptom in younger patient is endometriosis associated pain, including dysmenorrhea. Okay, this is the most common symptom, which, if mistreated, that may lead to endometriosis associated infertility. Endometriosis associated ovarian cancer has been recognized recently. It generally affects elder women, especially postmenopausal women who are symptom free and have no childbearing plans. Because this is a contrast one, because the reason they have given. Okay, you know the meaning of because, right? Because means for the reason they have been given here. So this is attached with the previous information. Because the symptoms and problems, the symptoms you can see in the initial line, they have explained the symptoms like pain, infertility, malignant transformation. These are the major clinical, and most common symptom is endometriosis, pain associated dysmenorrhea. Then coming to our current paragraph there, because the symptoms and problems in patients with endometriosis vary according to women's age. These are the factors: women's age, severity of disease, individual social requirements. So the 3 things are the requirements for the endometriosis. Okay, so which will vary from each person. Okay, and the last line is the aim of treatment should be specific to each patient. Okay, so symptoms also will be varied and the treatment also will be very specific, not common, not general. Treatment also will be very specific. Now look at the answer options. So first 2 lines you can see the symptoms, and in between they have mentioned about the endometriosis, which is associated with this problem, and endometriosis, this disease where the risk will be high, where postmenopausal women and symptom free and have no childbearing age. So there will be a risk of the endometriosis problem. But usually endometriosis, these are the characteristics of endometriosis. And coming to the last area, they have made the information. I told you, right? So you have to gather the information at the bottom of the paragraph. Okay, so this is the connector or contrast words that help you to find out the answer very perfectly. Now we can eliminate the answer options. First, look at option A. It is diverse. It is diverse. Diverse means very widespread, right? It is diverse and has to be dealt solitarily. It is diverse. Diverse indicates because the symptoms and problems in patients with endometriosis vary. vary according to women's age, severity of disease, individual social requirements. These are the things are diverse and has to be dealt solitarily. So last line, read the last line of the paragraph. The aim of treatment should be specific to each patient. So has to be dealt. Dealt means dealing with the condition, right? Solitarily means individually or alone we have to treat the patient. So it is diverse and has to be dealt solitarily. The exact information you can see in the paragraph last line, because the symptoms are problems. So they have listed out what are the symptoms and what are the risk factors, which is varying or which is very diverse, but when we are treating the patient we should focus individually. Okay, the exact information they have given. Next, coming to option B, it can cause disruption in clinical side. If you read the first line, disruption in clinical side, actually the information is little bit opposite to that. If you read the first line, endometriosis causes three major clinical disruptions. Okay, three major clinical disruption. It doesn't make any disruption in clinical side. Okay, meaning is different. Okay, so what they have given and what they have made as an option completely wrong, so you can eliminate option B. Coming to C, it causes pain induced dysmenorrhea. Pain including dysmenorrhea. It causes means endometriosis. It causes pain including dysmenorrhea. That is correct. But the thing is, this is not the exact point and this is not the point they have made. I told you already, you have to look the answer in the bottom of the paragraph, right? So, but this area in the middle of the paragraph, and it causes pain induced dysmenorrhea. Only about the symptoms they have explained. But what about the point? We have to find out the point, right? So we cannot choose this as a option. As well as pain induced dysmenorrhea, half information they have given. What about the remaining information? Pain, infertility, malignant transformations, and a lot of things there, right? So they need to conclude that also, but they haven't given. So this is not at all suitable for the question, and this is not the main point, and this is not in the right location. So three reasons are there to eliminate option C. Do elimination now. Coming to option D, it is more common patients who are mistreated. The person whoever not treating the condition properly, there will be a risk or mistreating. So third line you can see, which if mistreated may lead to endometriosis associated infertility. Whether the endometriosis treated or mistreated, what will happen? There will be a endometriosis associated infertility. This is also not in the location, as well as this is not the correct point. So you can eliminate option D. This is what I have explained previously. So in green color, I have highlighted the exact location. This is the contrast word and a meaningful. So I highlighted the correct option. It is diverse, has to be dealt solitarily. Exactly, you can see. Correct? So this is the exact example of this type of question. So you have to understand what are the benefits of dealing this strategy. Yes, definitely you can save your time. Okay, if you read the question, no need to get confused about what type of question is, whether it is attitude or opinion, or whether it is a detailed or other things. No need to get confused about it. So what point can be made? What point does writer make? Wherever you see the what point and make made, these are the words you can confirm this is a detailed type which comes under the comprehend type questions. And here what you have to do, so you have to look the answers in the bottom of the paragraph, and from where or how you have to use the approaches, and as I taught you, the approaches will help you to take the exact answer. Okay, do elimination all methods. Okay, so first of all you can save your time and you can improve your accuracy, as well as which will gain your confidence. Finally you can reach your target. Okay, target is finding the right answer, right? Definitely if you follow this, you can reach your target. These are the benefits. Yes. How to identify this type of questions? Yes, of course you can identify. As I said, in the first page we saw, right? What point can be made? Does writer make a point like so? These are the words we saw. So apart from that, you can directly locating the paragraph. Okay, directly locate the paragraph by seeing the question. And there sometimes you can see the contrast word. Sometimes if there is no contrast even, you can look into the last two lines or last sentence. That might be helpful you to find the enough right answers. Clear? All right. So this is about the detailed type questions which comes in the part C. As I said earlier, 2 to 4 questions you will deal in the part C by using these are the strategies, and you can get the correct answers if you follow these are the strategies. Okay, if you want to learn more strategies and more type of questions, and if you want to improve your accuracy in your reading listening, please contact us. We are providing all 4 modules effective training. So if you need further assistance, kindly contact us. The contact details have been given on the screen. Okay, so we will provide you individual attention. We are conducting discussion sessions, and as what you are expecting and what you are thinking in your mind, everything we can meet. So please contact us. Thank you.